By 2030, there is the potential that the world will have around 10 million fewer medical professionals than is needed for our globe's current population. But is there a solution in this AI revolution? Many of the headlines we see today talk about the potential dangers of AI, but does artificial intelligence bring the solutions? Elisabeth Staudinger is the member of the managing board of Siemens Healthineers and on the front lines as the world's governments and businesses race to find solutions. Elisabeth, welcome to this table and thank you for being here for the Swift Hour.
Thank you for having me, Matthew.
So let's talk about this for a minute, because when you read headlines about artificial intelligence, when you see people testifying on Capitol Hill or in front of parliaments around the world, the theme seems to consistently be the dangers that artificial intelligence poses to society and to humanity. But you see solutions, and especially as it relates to people's health. Can you talk a little bit about that?
Right. So when you look at AI, there is this narrative around, oh, maybe this is dangerous, maybe this will replace us. But if you think about it, if you look at what humans are really good at, it's being creative, it's being critical thinkers, it's being emotionally intelligent. And that's something where we as humans have that's a real capability and strength, which is not so easy to replace by technologies. At the same time, when you look at a lot of repetition, when you look at large data volumes, when you look at speed, that's what AI is really good at. And the way how we look at AI is really an opportunity of bringing together these two strengths, the particular strengths of us as human beings, as well as the strengths of what AI can bring. And we see a way of leveraging this to actually bring even more humaneness into healthcare.
And what do you see as some of the biggest challenges currently? Do you, we talked in the introduction about how you have cited that there are the potential to be 10 million fewer medical professionals in the world than what the world actually needs. How urgent is this challenge?
So you mentioned it, 10 million fewer medical professionals than are needed. Also, we see continuing growth in global population, and people are getting older, which is a good thing, right? People live longer, but this also comes with more, especially non-communicable diseases like stroke or heart attacks or cancer. And in order to address this even further increasing need for medical care, I believe technology can really help to tackle one of these greatest challenges of our times.
What are you looking for from the public sector as you navigate this new era of technology, and also just frankly the speed by which technology develops? What do you look for from government as you develop these?
There's a lot of opportunity when it comes to enabling also the usage of these technologies. So be it when it comes to what is the legal frameworks, what are the rules and regulations around deploying some of these new technologies. It's also when it comes to making data accessible in a way that we can use it for the benefit of other patients. And there is a lot of kind of framework conditions which can help accelerate and speed up this scaling up of the support that technology can bring to addressing these needs for better healthcare and also more personal care.
So as you navigate now sort of the global economy, can you talk a little bit about Siemens Healthineers' regional priorities in terms of how you're looking at the market today?
Well, so in Siemens Healthineers, we do anything that creates an image like X-ray or CT. We do blood tests, and we have a very strong footprint when it comes to cancer therapy. So where we can make the biggest difference is where we can contribute to addressing areas where it's about diagnosing, and the earlier you diagnose, the better choices you have when it comes to finding a good treatment to address a healthcare problem. And from a regional focus, there is, of course, the developed countries which have very mature healthcare systems, but there is a really rapidly increasing need also in low and middle income countries. So today, there is about 3 billion people on this planet who do not have good access to good levels of healthcare. And as one of our focus topics, we have decided to really spend energy and brain power on thinking about how can we change that? How can we help ramp up access to healthcare faster also in these countries? There is many things you can do. And in many areas, it really requires people teaming up and working together. So there is things we can contribute. There is things we need from the local communities, and governments also can be part of that.
So let's dive a little bit deeper into that, because it sounds like you see an ecosystem approach to this issue. Both there's a role for government, there's a role for the private sector, there's a role for the NGO space. So as a company, what do you see your role in trying to change this lack of care for, as you said, 3 billion of the world's population?
There is many ways how we can contribute, and maybe let me share one or two examples. So looking at a country like Egypt, for instance, where we do have a very clear challenge around having qualified healthcare professionals, doctors, but also nurses, people, technologists who can operate equipment. And there we've teamed up with the Ministry of Health, for instance, and created a Siemens Healthineers Academy where we train people in all these different specialties, which are required to make sure that from the investment the government has made in healthcare infrastructure, they really can maximize the impact they can create and maximize the number of people they can reach. So this is one example where we are teaming up with a government, where we bring in not only our technical capabilities, but also the know-how we have around training, educating, and upskilling the healthcare professionals in a country. Another example, very different, is a program we have started in Kenya, where, as not unusual in these countries where you may have not so good roads and people are distributed across the country, and it's not easy to bring good quality healthcare to actually where the people live. And there we've teamed up with a company supplying drones and are creating a network where we use drones to fly vaccines, but also blood samples and medicine between the urban areas to the places where the people actually are. And that's, for me, one of these very creative examples where, driven by this need, ideas emerge which are really leapfrogging. So you're not going through the normal path. So first I have to build roads, and then I can reach the people, and then I can have logistics, and then I can start building labs. But you come up with smart, creative ideas applying most modern technologies to address some of these challenges.
Talk a little bit about, I'd love to learn a little bit more about your story and your leadership in business. What are, over these last few years, some key lessons in leadership that you think about on a regular basis as you help lead the company?
I've spent the past 10 years living in Asia. So I've been very close to parts of the world where access to care is not something anybody has and is easily accessible. And that really changes your perspective, and it creates awareness around what is it that is really needed. And that was one of my focus areas in the past years, to make sure that as we're thinking about new products, as we're thinking about what to focus our energy on next, that we keep these requirements in mind, so that we not only focus, okay, what do the more developed countries need? What is the medical progress that is happening in these places? But also, how can we take these ideas in new creative ways and make them more accessible to people around the globe? So that has been a very important aspect also of that I've been driving over the past years. I also believe, and this is a topic which also Concordia Summit here reflects, is that we need to team up. The challenges are too big and too complex for one party to be able to solve them. And it's about creating this ecosystem of different partners coming together to then not only place a piece of equipment, but then you also need the people who know how to run it. You need patients and citizens who understand how much it helps, if you catch disease early. Plus, you have other parties involved which can team up to make a difference and create a real impact on people's lives.
During this, what's been, when you think about the COVID-19 pandemic, when you think about all the dramatic geopolitical changes taking place around the world, you're here for the week of the United Nations General Assembly in New York, which is both such a unique time for the world when the majority of the world's heads of state are all in one city at one time, but also at a critical juncture. Are you feeling optimistic about the future? Are you feeling pessimistic about the future?
I'm always optimistic about the future, and I continue to see tons of opportunity. I mean, there is, of course, certain boundary conditions which not necessarily have made things easier, and I'm certain we'll be hearing a lot as we're mapping against the Sustainable Development Goals that there is quite a number of areas where things are not on track or where we've really gone backwards throughout this period of COVID and some of the challenges the world has been working through. But at the same time, I mean, I think there is a lot of willingness to engage. There is a lot of passion around making this world a better place. And if I look at us as Siemens Healthineers, we really focus on, we say we want to pioneer breakthroughs in healthcare, and we are very serious about that. And if I look at the energy, also coming from the organization, the team to think, okay, how can we bring healthcare to people everywhere? And regardless of who they are or where they live, and do that in a sustainable manner. There is so much passion around this topic, which makes me very optimistic that we will continue to see progress.
So you see the challenges, but there's also so much to be optimistic about because people are so much more aware and much more involved as we determine next steps.
And I'm deeply convinced that that makes a difference. You know, if you have people who sit in certain parts of the healthcare system or in the players like us who are working on what are the next technologies we can be working on. And if that becomes part of the mission, we are here to do this because we want to reach more people. We don't want it to make a difference where you live. We want healthcare to be accessible. It does also drive progress and innovation, and that makes me really optimistic.
Well, Elisabeth, thank you so much for joining for this discussion. It's great to sit down with you, and you leave me with much to be optimistic about.
Thank you very much.